postactivation, potentiation following different modes of exercise. Cardiff School of Sport, University of Wales Institute, Cardiff, United Kingdom, Regional Athletics Centre, North East England Athletics, United Kingdom, and School of Sport, Human Performance Laboratory, University of Cumbria, Lancaster, United Kingdom. Introduction. Performance of skeletal muscle is significantly affected by its contractile history. Because acute responses are affected by the muscle contractions preceding the activity, increased muscular activity results in decreased neuromuscular force generation and fatigue, having a negative impact on subsequent strength and power performance. In contrast, optimal previous muscular activity can increase force generation and improve subsequent strength and power performance, a phenomenon termed postactivation potentiation, PAP. This enhancement has been primarily attributed to two mechanisms: regulatory light chain phosphorylation and increased recruitment of motor units. Regulatory light chain phosphorylation has been shown to increase the sensitivity of the actin-myosin interaction to the calcium ions released from the sarcoplasmic reticulum and alter the structure of the myosin head, resulting in a higher force producing state for the myosin crossbridges. For the second mechanism, it is postulated that previous contractions increase the excitation potential across the spinal cord, which lasts for several minutes after the initial contraction, resulting in increased postsynaptic potentials and subsequently increased force generation capacity. One of the factors affecting PAP is the intensity of conditioning activity, with higher intensity activities appearing to be more effective. Indeed, the majority of studies examining the effect of PAP on athletic performance have reported positive effects when using heavy weights before explosive movements such as short sprints, vertical jumps, or explosive strength jumps. Chiu et al. Used 5 sets of 1 back squat repetition at 90% the subject's 1 repetition maximum, 1 RM, and reported a significant improvement in jump squat power using 30, 50, and 70% of 1 RM. Their results agree with findings by Weber et al., who reported an increase in vertical ground reaction force and jump height after 5 repetitions of 85 1RM. McBride et al. Used 3 repetitions of 90% 1RM and reported a significant improvement in 40-meter sprint times of football players. Finally, Kilduff et al. Used a 3RM back squat set, reported a 6.8 increase in counter movement jump CMJ performance. Conversely, Jones and Lees reported no improvement in CMJ after 5 squat repetitions at 85% of 1RM. Nevertheless, there was no reduction in performance, suggesting that execution of heavy resistance exercise before CMJ was not detrimental. It is possible, therefore, that Jones and Lee did not observe fatigue because of induced PAP, as fatigue and PAP are initiated together after muscular contractions. There is little evidence in the literature to indicate that PAP can affect maximum force generation. However, PAP can improve rate of force development, which is an important factor in explosive sport activities where high power outputs are required. Such high power output in explosive sports is usually achieved by substantial use of stretch shortening cycle plyometrics. Despite the potential of plyometric exercises as a PAP stimulus, little is known about the acute effect of plyometric exercises have on subsequent muscular performance. Masamoto et al. Examined the effects of 3 double leg tuck jumps and 2 depth jumps on subsequent 1RM squat performance and reported 3.5 improvement on the load lifted. McBride et al. Used a loaded CMJ for a single set of 3 repetitions at 30% of 1RM before a 40-meter sprint, but found no differences. The lack of any difference in performance was attributed to the single set being insufficient to induce PAP. The small number of studies and contradicting results merit further investigation on the ability of plyometric exercises to induce PAP. The potential impact of PAP on explosive sports raises another issue that merits further investigation. Many explosive sports, such as jumps and throws in athletics and Olympic weightlifting, involve repeated trials. Therefore, it is important to gain an understanding of PAP effects on repeated performances. For example, repeated CMJ trials, Simelios et al. Assessed the jump height of a CMJ at 6 points. These time points were a baseline after each set of conditioning jumps, 3 sets, and a 5, and 10 minutes of recovery. The findings indicated that after an initial improvement of CMJ performance, the jump height subsequently remained similar or decreased after the first loaded jump squat. However, because heavy weights have been shown to elicit PAP more effectively, a higher load may have yielded different results. Lastly, no information exists on the ability of plyometric exercises to elicit PAP on repeated performances. Therefore, the aim of the present study was to A. Examine the PAP effects induced by heavy weights on plyometric exercises, on repeated trials, or B. Compare performances in repeated trials between the two modes of exercise. It was hypothesized that A. Both heavy weights and plyometric exercises would induce PAP, and B. Plyometric exercises would have a greater impact on subsequent performance than heavy weight exercise. Methods. Experimental approach to the problem. The PAP effects induced by heavy weight and plyometric exercises on repeated trials and any potential differences between the two conditioning stimuli were examined using a randomized counterbalanced repeated measure design. Subjects performed 3 CMJs on 3 separate occasions. On each occasion, each CMJ was preceded by a conditioning stimulus, with the subsequent repeated 3 times. Figure 1. The conditioning stimuli were resistance exercise, squat, B. Plyometric exercises, plyo, or C. Inactivity, rest. The plyometric exercise conditioning stimulus consisted of 4 different plyometric exercises totaling 24-foot contacts, whereas one set of 3 repetitions at 3 RM was used as a resistance exercise conditioning stimulus. Rest served as a control condition and was used to compare the effects of contractile history between subjects using inactive recovery and those using preconditioning stimulus. Maximum displacement, Dmax, peak power, P peak, and peak vertical force, F peak, were recorded from a force plate, whereas RFD and relative force, F divided by body mass, were calculated for every trial. The variables examined were selected as they were commonly used for assessing explosive performance and can provide an indication of any PAP effects. Subjects: 13 male competitive athletes, age 22 plus or minus 3 years, height 182.4 plus or minus 4.3 centimeters, and body mass 82.7 plus or minus 9.2 kg, volunteered to participate in the current investigation and provided written informed consent. The subjects participated in sports or events where explosive power was a significant aspect: 100, 200, 400 meters, 7 of them, 400 meter hurdles, 1 of them, pole vault, 1, long jump, 2, and rugby, 2. When testing took place, all subjects were in the competitive phase of their training cycle, although at different points, because the athletics season finishes in the summer, whereas the rugby season starts in spring. All subjects included regular and planned resistance training as part of their sport training program for at least 2 years before the study. Their training included a minimum of 3 sessions per week, with training loads ranging from 30 to 90% of 1 RM, depending on the phase of the training cycle. Finally, the subjects were free of any medical conditions or lower limb injuries in the last 6 months before the investigation. The study was approved by the University of Wales Institute Cardiff Ethics Committee. Procedures. All subjects initially visited the laboratory to ensure familiarity with the half squat, the plyometric exercises, and the CMJ technique, and to have their age, height, weight recorded. Height was measured to the nearest 10th centimeter using a stadiometer, Harpenden, Burgess Hill, United Kingdom, and weight was measured using a calibrated Brown's beam scale, SECA, Birmingham, United Kingdom, and recorded to the nearest 10th kilogram. Subjects were then required to complete a set of stabilization tests to determine whether they had sufficient stabilization strength to perform the plyometric exercises. These tests comprised of a static stand, hip flex, single leg squat, hop for distance, hop down from a 0.3 meter platform, a repeated jump test, and to be able to squat 1.5 times their body mass. Form and technique were observed and used to identify successful completion of the test, with all subjects successfully completing all the stabilization strength tests. Each subject's 3RM half squat was then determined, with 3RM defined as a load that caused failure on the third repetition without loss of proper exercise technique. To establish the 3RM load, subjects attempted 3 repetitions of a load and, if successful, increased the loading. A 5-minute rest interval was allowed between trials, with 3 to 5 trials typically required to determine each subject's 3RM. The subjects then visited a laboratory on 3 separate sessions. A standardized dynamic warm-up protocol was used for all sessions, which consisted of 400 meters jogging and 4 repetitions of a dynamic drills over 15 meters. Heel flicks, high knee jogging, walking lunges, and walking hamstring sweeps. After the standardized warm-up, and subjects were randomly assigned to one of the experimental groups: inactivity, rest, plyometric exercises, plyo, or heavy weight exercises, squat. Rest executed no additional warm-up. Plyo performed 1 set of 6 contacts of alternate speed bounds, right leg speed hops, left leg speed hops, and vertical bounds. Total foot contacts 24, with a 15-second rest interval allowed between each exercise. Squat subjects performed 2 sets of 6 to 10 half squats, 90% knee flexion at 60 and 85% of 3RM, respectively, with a minimum of 2-minute rest between sets. After the condition-specific warm-up, a minimum rest of 2 minutes was allowed. The subjects then performed the conditioning stimulus described below, with 5-minute rests and subsequently 3 counter-movement jumps with 10 minutes rest. This sequence was performed 3 times to approximate a sporting situation, because a number of events in athletics have repeated attempts. A schematic diagram of experimental procedure can be seen in Figure 1. The conditioning stimulus for the plyo group was 1 set of 6 foot contacts per plyo exercise, alternate speed bounds, right leg speed hops, left leg speed hops, and vertical bounds, totaling 24 foot contacts per subject per trial. A 15-second resting interval between each exercise was allowed. Subjects were specifically instructed to minimize ground contact time and maintain technique on each repetition. The total time required for each subject to complete the plyometric exercises was approximately 70 seconds. The conditioning stimulus for the squat group was 1 set of 3 half squats at 3RM, performed as quickly as possible using the standard 20 kilogram Olympic barbell and weight plates. Evanco, Reno, Nevada, USA. All residence exercises were performed within the confines of a weightlifting safety cage. Subjects were permitted to use weightlifting belts if desired. The use of support knee wraps and weightlifting bodysuits was not permitted. According to the International Powerlifting Federation rules, a lift was deemed to be successful if the subject could descend until the inguinal fold was lower than the patella and rise without help. Approximately 15 seconds was required for each subject to complete the squat exercise. After the conditioning stimulus, subjects remained inactive for a period of 5 minutes before performing 3 CMJs, separated by approximately 8 seconds each. The CMJ is commonly used for assessing lower limb explosive power and has been shown to be highly reliable, inter-class coefficient of 0.97. In studies using similar CMJ protocols to ours, inter-class correlation coefficients were also high, 0.95. Counter-movement jumps were initiated from an upright standing position, and upon command, the subjects squatted. The degree of knee bend used by each subject was self-determined, and then immediately jump vertically. The subjects were specifically instructed to aim for the maximum height. To isolate the contribution from the lower limbs, subjects were requested to place their hands on their hips throughout each jump. A 10-minute rest interval was provided between the CMJs and the following conditioning stimulus. The rest interval was used to replicate the approximate temporal demands during the events of athletics competition. After the 3rd week and final set repetition, subjects were asked to undertake a cool down consisting of light jogging and stretching. maximum distance displacement, Dmax, peak power, P peak, and peak vertical force, F peak, were measured on a Kistler force platform with an internal charge amplifier, model 9287BA Kistler, Winterthur, Switzerland. The force data were sampled at 1000 Hz for 3 seconds and analyzed using BioWare software, version 3.2.6 Kistler. Rate of force development was calculated as maximum force divided by time to maximum force. Finally, relative force, rel F, was calculated as absolute force divided by body mass. For all measurements, the highest CMJ was used from each trial for each condition to reduce variability. Subjects refrained from any strenuous activity or resistance training at least 24 hours before testing. All tests took place at the same time of the day and with a minimum of 24 hours intervening. Statistical analysis. Data were checked for normality using a Shapiro-Wilks test. Because data were found to deviate from normal distribution, Friedman's test was used to examine the differences within trials for all performance measures, Dmax, P peak, F peak, RFD, and rel F. Where the difference was revealed, Wilcoxon's test was used to identify those differences. Significance level was set at less than or equal to 0.05. Because the measurements were directly or indirectly intercorrelated, no adjustments were made for multiple comparisons, but caution was exercised in the interpretation of the results. All statistical analysis were conducted using SPSS v14.0. Results. A significant difference was revealed for displacement, P equals 0.009, figure 2. The pairwise comparisons indicated differences between squat trial 1 and with plyo trial 1, 0.044, and rest trial 3, 0.010, and squat trial 3 with plyo trial 1, 0.018, figure 2. No differences were revealed for any of the other variables. Descriptives, mean, plus or minus SD for peak, P peak, F peak, RFD, rel F, can be seen in Table 1. Discussion. The aim of the present study was to investigate PAP by examining the effects of heavy weight or plyometric exercises on repeated CMG performance and to compare CMG performances between the two modes of exercise. Our findings show that heavy weight-induced PAP improved to some extent jump height compared to plyometric exercises, or inactivity, as statistically significant differences were revealed in some comparisons only, whereas plyometric exercises presented no additional benefit to inactivity. Finally, neither heavy weight nor plyometric exercises showed any significant improvements over the course of 3 trials. To the author's knowledge, this was the first study to directly compare heavyweight resistance and plyometric exercises in relation to PAP over repeated trials preceded by the conditioning activity. Heavy weights have been shown to improve vertical jump performance in both intervention. The acute studies. In contrast, previous studies have reported no differences in acute CMJ performance after heavy resistance exercise. Indeed, in the current study, no differences were revealed in CMJ jump height over the course of 3 trials. These results agree with the findings of Jones and Lee, who reported no effect of heavy resistance exercise on repeated CMJ performance using similar rest intervals. It is worth noting that both the current study and that of Jones and Lees employed a similar sample, with all subjects involved in sports requiring the development of explosive strength, particularly in the hip, knee extensors, and ankle plantar flexors, and had experience performing resistance exercises. Although such athletes may have benefited from improved motor unit synchronization, this was not evident in the present study. Notwithstanding, the lack of improvement in jump height is worth noting from a practical perspective that no impairment in performance was evident, as PAP and fatigue are simultaneously initiated after muscle contractions. We posit that the effect of PAP was sufficient to counteract the effects of fatigue in the squat group, but inadequate for enhancing performance. One interesting finding of the study was the consistency of the performance over those trials, despite no immediate effect on squat stimulus on the repeated CMJs. When the coefficient variation, CV, was calculated, SD divided by average times 100, the squat group demonstrated a much lower CV, 1.3%, compared to plyo, 5.1%, and rest, 4.3%. A similar displacement performance consistency was calculated from the study of Jones and Leeds, whereas the CV was 1.2. Although all the above percentages appeared small, the CV needs to be considered in comparison to the performance gains expected. Significant differences in vertical jump height performance are in the region of 4% above. A CV value of 4%, such as in the plyo and rest groups, would make the interpretation of results very difficult, because any performance gain could be attributed to the variability of the measure. In addition, CV values for force, 1.6%, and power, 0.7%, indicate high consistency. It is suggested that in sports involving repeated performances and in which force and power are crucial, such as the long jump, heavy resistance exercises will assist in maintaining the required muscle output to allow the athlete to focus on technical execution of the skill. Plyometric exercises have been widely used as a training method to improve the efficiency of the stretch shortening cycle, as well as the muscle tendon unit's ability to tolerate stretch loads. The positive effects obtained by this form of training on vertical jump performance have been established. However, less is known about the acute effects of plyometrics or power exercises on a conditioning stimulus on subsequent vertical jump performance. To the author's knowledge, this is the very first study to examine the effect of plyometric exercises on subsequent plyometric activity. Our study indicated that previous plyometric exercises have no impact on force or power production, and that they present no additional benefit to resting between trials. Although no previous studies have examined the effects of plyometric exercises on subsequent CMJ performance, it was hypothesized that plyo would improve power performance because of PAP increasing RFD and explosive activities. Jensen and Eben et al. Propose that the concepts of plyometric intensity should be re-examined, as they report that high-intensity plyometric exercises such as depth jumps and are recruiting muscle fibers as any other less intense plyometric exercises, such as single leg hops. Interestingly, the vertical jump was shown to have higher muscle fiber recruitment compared to the other plyometric exercises used in their study. It is possible that the plyo conditioning exercises used in the present study did not result in sufficiently high recruitment of muscle fibers to elevate the postsynaptic potentials. This assumption is supported by Masamoto et al., who used tuck jumps, high muscle fiber recruitment, resulting in increased 1RM performance. However, the opposite could also hold true. The plyometric conditioning exercises could have resulted in high recruitment of muscle fibers at maximum rate, in which case PAP would offer little benefit. Unfortunately, in the present study, as in Masamoto et al., electromyography, EMG, was unavailable, making it impossible to accept or refute any of these contentions. Therefore, future studies should use EMG to assist in offering an explanation on the mechanisms by which plyometric exercises enhance subsequent strength and power performance, especially in activities that involve the stretch shortening cycle. Finally, it is possible that the duration of the plyometric exercises, less than 70 seconds, in the current study was too long. Van der Voort et al. Found that potentiation was partially suppressed by fatigue and muscle contractions over 10 seconds in duration, which may explain why shorter duration plyometric exercises have previously improved performance. The rest duration used in our study has previously been shown to be sufficient for allowing fatigue to subside. However, the duration of the conditioning exercises in these studies was lower compared to the exercise duration used in the present study, indicating that the complex relationship between duration and contractions and rest intervals warrants further investigation. Practical applications. Although the majority of research into PAP has recommended its use for performance enhancement, few studies have specifically investigated how such acute augmentation may be achieved by repeated performances, as those encountered in athletics competition. The results of the present study indicated that lower body performance, as measured by CMJ height, is enhanced when preceded by 3 half squats at 3 RM followed by 5 minutes of rest, compared to plyometric exercises and rest. Therefore, the inclusion of sets of squats into a warm-up routine before and during the early stages of intermittent performance may provide a beneficial alternative to warming up practices. In addition, the inclusion of the above protocol in the athlete's preparation for the next performance, next jump or throw, will ensure consistent force generation across trials. The findings of the present study may be of particular importance to athletes involved in disciplines where maximum brief effort are required, such as jumping events in track and field, where success is a product of force and takeoff velocity. Although the extent of performance augmentation noted from the PAP mechanism is relatively small, the potential benefit that such acute improvements in performance hold to highly conditioned athletes should not be underestimated.